Hi, everyone. Welcome to Your Health, Your Choice with Dr. David. My name is Shari Kulanu. I am the executive producer of this show. I am also Dr. David's sister. In this episode, we're going to be talking about something very near and dear to Dr. David's heart, the topic of pediatric medical cannabis. Or as people often ask me, wait, you're giving weed to kids? Hi, Dr. David. How are you today?
I'm doing well. It's good to see you again. It's been a long time.
It has been. It's good to see you too. So I want to dive right into talking about this topic of pediatric medical cannabis. And a lot of times when I speak to people, they're very surprised that they're in our clinic that we treat children with medical cannabis. There's a lot of people who are curious as to how we give this to kids. And I'm wondering if you could talk a little bit about the stigma that is sort of associated with medical cannabis in children.
Certainly. So there's a few aspects to this. First of all, there's obviously been still the remnants of the 1980s just say no to drugs, and that marijuana was lumped in with a lot of hard drugs like cocaine and heroin. And so there are certainly, especially people our age who are now the age of parents, that would have been indoctrinated by that beginning in the first place. The reality of the situation is that, first of all, we have to understand that we're talking about two different things potentially with CBD and THC, and that CBD has no intoxicating euphoric qualities whatsoever. And that's certainly the first line treatment when it comes to legal medical cannabis that we're talking about with families. But the patients who we are using THC on are some of the most impacted, negatively affected people, children that I take care of. And in particular, the overwhelming majority are people with autism. Children with autism, not just kids who aren't speaking, but kids who are hitting themselves and beating themselves up, banging their heads against the wall. Kids who are acting violent towards their parents, towards their teachers, towards their peers, biting, kicking, screaming, running away, not able to be in any control whatsoever. So we're talking about, very, very specific when it comes to young children as to who is being treated with this. And these are kids who are being otherwise put on stimulant medications and other types of narcotics, or even more so, putting on antipsychotic medications like Risperdal and Abilify, which are antipsychotic medications and the only two medications that are FDA approved for autism. So many a family who comes to me have either had negative reactions to those things or just are not comfortable putting on their kids on narcotics or antipsychotics and are looking for a different approach.
Now, one of the things that I've heard from some of the parents of our pediatric patients is trying to explain this to other people, right? Maybe their parents' generation, which were from the 50s, who had a completely different, sort of scare around what medical cannabis or what cannabis in general did. There's this idea that if children start taking medical cannabis at a young age, or at any, pre-18 type of thing, that it will affect their cognitive ability, their ability to learn, that it's going to result in them using pot or using weed, however you want to call it, when they get older, that they're going to be, stoners, as people would say. There's a fear, right? There's a fear that this could lead to harder drugs. It's all of these things that we've been told over the years. What is some guidance that you can give to people who have those fears?
Certainly. So, there has been very little research that's been done on cognitive effects, memory effects in general with cannabis because of the Schedule I classification that allows for no medical research to be done on any of these types of products. CBD, I really have no problems with. There's no intoxicating effects from. When it comes to and we definitely think that there can be effects on cognitive and function, but we're talking about the young kids that we're doing are already significantly cognitively and socially impaired. And their other options are being put on narcotics and put on antipsychotic medications. But the thing is this, first of all, because of the fact that we always suggest doing CBD first, some kids don't even need to use THC. Secondly, CBD blocks the intoxicating effects of THC when used properly. So we have people who are using THC along with CBD who are not getting high. Now, nobody wants their kid to be stoned, and no parent is going to keep on giving it to their child if they're seeing that their kid is acting stoned. If that's the case, they're going to let me know. We're going to increase the CBD. We're going to change the product, maybe changing the dosing, maybe even change from a Delta 9 to a Delta 8 THC or a THCA, which also doesn't have the intoxicating effects that Delta 9 THC. So there's a lot of options that go on with that. Now, there is a second population, though, of kids in the teenagers. And we do see families who bring their kids in for anxiety and depression. Most of those kids are using it on their own already, and the parents are wanting to make sure that their kids are getting a clean, safe product and are being managed by a physician who is very well knowledgeable and can provide the best information so that they can choose the products and the dosings that will be the most effective. Some people will use things like microdosing, where they give very tiny doses throughout the day, not at a level that would even cause an intoxicating high.
Well, let me ask you a question, because you've covered so many different, touch points just in the answer to that, right? So, for example, one of the things that you mentioned is that for teenagers, some of the parents know that their children are basically self-medicating, right? Which can lead to a host of issues down the road. So when you meet with those patients, are you predominantly meeting with the parents? Are you meeting with the teenagers? Are you meeting with them in combination with each other? Like, how does that differ for you compared to when you're working with young children?
Certainly, it's always in combination. I'm a very transparent person. Kids need to know what's going on. Interesting, a lot of the teens are incredibly knowledgeable, more so than the adults are. And a lot of the teenagers have done their research. They know things. They're very aware of it. But also the parents have figured out that their kid medically is doing better. Now, there is absolutely concern because it's felt that brain development still happens until age 22. And so, yes, these teenagers who are using it may still be running into those issues. But as I said, these are mostly parents who have found out their kids are doing it. Their kids shared the information with them, and they felt that this was the best option for them. So nobody is giving cannabis without a parent's approval. Nobody is getting cannabis without going through with me all of the risks and benefits, going through the informed consent form so that they're completely aware of what the potential issues can be. And of course, they don't get it indefinitely. First of all, if the parents don't like it, parents are the only ones who can buy it. Kids are not allowed to buy it on their own. Like, you have to be 18 years old in order to buy cannabis. So again, if a parent is not happy with what they're seeing, they're not going to buy it and give it to them anymore. And of course, they don't have to recertify either. That's an option. And yes, we have a very large percentage of patients who come back and become recertified, and it's because they feel that it is a net positive for their child.
You mentioned earlier Delta 8, Delta 9, and I believe THCA. Can you explain a little bit more what that is?
Certainly. So in the plant as it grows, and if a person were to start eating or juicing cannabis, there's not an intoxicating high from that. THCA is the name of that raw material. Only when it is heated does it convert to 9-delta THC, which is the active ingredient when most people think about cannabis and the getting high aspect of it. But it's a very dose-dependent thing. But that's what they're talking about. Now, there are other forms of THC, and one's called Delta 8 THC. Delta 8 is much less intoxicating than Delta 9 THC, but it does bring a lot of the same clinical benefits.
Statistics show that the overwhelming majority of adults in this country have experimented at least once with marijuana in some capacity. And if you were to ask them, well, what was there Delta 8 in it? Was it Delta 9? All of that type of stuff. They'll actually have no idea what you're talking about. So to me, it really does drive home the point that to be working with a physician who's knowledgeable on this type of detail is critical, especially when you're talking about children, to understand that certain components will have more of a psychoactive effect than others.
Yeah, and it's also important, since you're talking about recreational, to understand something. Kids are not getting buds. They're not getting a bag of weed. Flower, as it's referred to, is not allowed to be purchased under 18 years of age. So we're talking about edible products, capsules, tinctures. We're talking about topical products like patches, some gels, etc. The only inhaled form that's allowed is in a vaporized type of form as well. So that's an important thing, that I don't want people to think kids are rolling up joints and smoking it and putting it into a bong and smoking it. That's not happening. Okay. There's no combustion that's happening here at all. Okay. But to have an understanding that there's many different types of cannabis plants that are out there. So when we talk about strains, you will hear people talk about indicas versus sativas versus hybrids. Sativas most often have more of an up energetic type of feeling, often very good for mental health conditions, especially for depression and anxiety. Whereas indica plants typically have more of a calming, sedating, better for sleep, better for pain types of symptoms, whereas hybrids are mixtures of those. Now, if you were to if you wouldn't know what you were doing and you tried giving somebody a strain from an indica, there's a good chance that kid's going to fall asleep in school, especially if it's some of the more sedating forms. And of course, taking a sativa may make them stay up at night and not be able to fall asleep. So being educated at properly as to what these different types of strains are, as well as the terpenes, which is what makes each strain unique. So that's the other main ingredient, are terpenes. Some terpenes are really good for focus and attention. Some terpenes are better for pain. Some terpenes are better for anxiety. So learning about the different terpenes and directing the strain choice is also very important to be successful.
I know there have been some interesting issues that have come to the surface around schools not wanting, like, if a child is legally certified to receive medical cannabis through a certifying qualified physician such as yourself, and they are successfully being treated with that as a medication, when they go back to school, many of the schools are not allowing the nurses who typically would dispense regular medications to students throughout the day to even have them on campus. So talk a little bit about the special issue that's related to school with kids.
Okay, so if we take this back to November, December of 2019, the Department of Education for Florida had asked all school districts to submit by January 1st for review a protocol that would allow families to be able to come onto campus and to be able to administer to their children. COVID then happened. I can't blame the health departments for not being, and the Department of Health for not being as on top of this in education. We had a pandemic that we were worrying about. But in general, what was happening prior to that is that parents could come, sign their kid out from school, take their kid off of the property, administer it, and then sign their kids back in. The challenge is that the only people who was allowed to store, carry, hand out, give cannabis to kids is a caregiver. And in the state of Florida, a child is only allowed 2 caregivers. Adults are allowed 1. And so that's usually their parents, because they're the ones who are giving it, purchasing, etc. Okay. Also, a person cannot be a caregiver to a whole bunch of other people. So that became a problem because the nurses weren't necessarily enrolling as the caregiver for the children, but not only that, they couldn't just be a caregiver for a whole bunch of other children. So that became part of the problem, and that's the reason why the policies were supposed to be put into place, that the parents could come on campus. There was supposed to be a designated room in each school that was put aside that they can administer it safely and then not leave any on campus, and that obviously would be helpful for some. Of course, not every family can a parent get to school during lunchtime or whatever in order to do that. So that to me had a little bit of a bias towards people who were more likely to be who are more well off, that maybe aren't 2-parent workers in a family, because that's a significant problem where, a lot of kids go to charter schools or go to private schools where they're not just right around the corner in the neighborhood. And so I know kids who travel 45 minutes to get to a school. Well, a parent's is going to be really challenged to do that in addition to picking their kid up and dropping their kid off. So it wasn't the perfect system, but it never came to be in the first place because of, I think, and much because of COVID. I do envision that this will be revisited at some point, but right now the only option is to go ahead and come on to sign your kid out. One other option that parents are using are patches, which are a sustained release of a small amount that's being released all day long. Quite frankly, a dose that really wouldn't cause an intoxicating amount anyways. And that way the teachers or nurses are not administering it because it was administered before they went to school, similar to if a child received a tincture or a capsule before they went to school.
Are you aware of any other states that have found a way to implement this in schools like that? Is there a successful model that Florida could potentially be looking at?
Yeah, I haven't studied that to know.
Okay, good to know. Well, but it is a really interesting thing because, as you said, it brings up socioeconomic considerations. And it also brings up this idea that even if a nurse was able to be designated as one of the caregivers, only caregivers can purchase for the child. So now you basically just took away one of the people who potentially can go do the purchasing. I want to talk about some of the other special legal requirements that are in place for pediatric medical cannabis patients. For example, I know that unlike adult patients, if a child is going to be certified, they have to be certified by what is called in the state of Florida, a qualified physician, an MD or a DO that has gone through the state's program. And there's a listing on the state's website that people can go to in order to find out who those people are in their areas. There are, if a person under the age of 18 is going to get certified, however, it needs to be reviewed by another doctor. How does that work?
Yes, so that's really what the law says. So it's first to be understood that any physician licensed in the state of Florida is allowed to be a medical cannabis certifying doctor. Of course, some doctors choose, very few pediatricians choose to do that.
And so just to clarify, they just can't choose to do that. They need to go through the state.
Yes, there is a certification course. It's a 2-hour course. In my opinion, it's a substandard approach. When I first did it, it was a 4-hour course where there was actually teaching about the treatments, the medicines here. This 2-hour course is all about the law, understanding every aspect of the law and how to legally put a patient into the state registry. The current setup right now, doctors are not educated 1 second about this actual medicine, and yet they're allowed to be a certifying physician. Now, that's quite different from me because I've done years of study on this. And so, I mean, at this point, I feel I pretty much know more than any pediatrician and almost any doctor that's out there about medical cannabis because of the work that I chose to do on the side, because I feel that as a physician, I need to have a level of expertise and not just a nice guy who's willing to certify somebody. Now, for anybody under the age of 18, there has to be a second doctor who writes a letter that they, in their opinion, on reviewing the medical information, that the benefits outweigh the risks for this individual. And that needs to be put on the chart for that patient in the certifying physician's chart.
So under the current law, neither of those doctors has to be, the first doctor has to be certified, a qualified, having gone through the state course. The second doctor, though, does not, right? They just need to be any doctor.
Licensed physician.
Any licensed physician, right. But under the current law, neither of those people has to be a pediatrician, even if it's a child that's being certified.
And neither of those people have to even know how to properly spell pot.
Okay.
I mean, there's no qualifications whatsoever. Well, so yeah, I mean, realistically, a 2-hour course, 2 initials after your name and opposable thumbs can get you make you a certifying physician. But that's not who we are. There are the doctors out there. That's what the law says. But to me, who would go to a doctor that does that, especially if you're taking care of young children and especially if you're taking care of special needs children?
Well, we're going to wrap up this episode there. Thank you, Dr. David, for this really insightful conversation and for being willing, as always, to go deep and to share personally what's going on for you. This is part 1 of a 3-part series, so we hope you'll join us for part 2 soon. Thank you.